Hey guys, Jeremy here at Hyperbaric Service Pros. We're here with Matt from Healthspan Recovery. We just installed another hyperbaric chamber for them. They have a soft shell. They just did an upgrade to a hard shell. Now they have 2 atmospheres. Their old one was only 1.3. And then this system has the air conditioner in it. So this is like the Cadillac of hyperbarics that they have here. So Matt, you guys have been using hyperbarics before I got here to install this. How do you guys use hyperbarics for your patients?
So it's probably the thing we get called about most. 4 or 5 calls a day for various atmospheres, various treatment protocols. We have 5, 6, 7-year-old patients that come in for brain health, autism, cognitive disorders, autoimmunity, and we have 90-year-olds that come in for cognitive decline, Alzheimer's, cerebral palsy, dementia, that kind of thing. Of course, everyone in between, athletes, professionals that come in just for sports recovery. We use it for pre-post-operative care, and just everything in between. It's by far the most popular thing we have.
That's quite a wide range. And then, are there any results that you can speak of on some of these patients?
The younger patients, the thing we see the most is behavioral changes. The older patients, we see symptom relief. You know, we have a Parkinson's patient that's coming in, noticeably different in tremor and how she can balance, how she can walk, how she can think. And then of course a lot of plastic surgeons will call to help aid in their therapies and their procedures. And so bruising, inflammation relief, pain management are very, very noticeable changes.
So do you guys offer packages then for those type of people who need surgery relief?
We have memberships that discount these services greatly, and we work with professionals in the area. If you want to come in, we can certainly talk about that.
So what would a single session cost, and then what would some of the packages kind of look like?
Our soft shell chambers are $150 a session. The hard shell is $199, and then of course we knock $100 off per session as a member, and that's the biggest member perk that we have. So we have many other services that work very well in tandem with these procedures and so.
And then how much is the membership?
$250 a month.
Okay, that's not bad.
Yeah.
So if someone, wow, that's huge savings, because the clients that call me, they just got a diagnosis, they got cancer, you know, they need a chamber right now, they want treatment right now, but the sessions are $200 a session, exactly. $250 a session. Exactly. But if you could just pay $250 one time and take $100 off, that's basically kind of a package almost. That'd be better than a package, because with a package, you're committing to a number of sessions and you're paying for it up front. If you just did the membership, you could come in, use it as many times as you need. The discount applies all the way across the board. It probably might even save more money than doing a package. So that's very interesting.
Based on what their issues are, we have other things that tend to enhance the benefits of this too. And so we have protocols that we recommend just to accelerate the healing process. Got it.
Is there, what would you say to somebody who doesn't know anything about HBOT? The first person who calls you, they've never heard of it, they just now heard of it. What do you tell new people?
In my 20 years as being a practitioner, I don't think I've come across a more impactful modality from a healing standpoint. Things that it does to the body and that it can do to help with just about everything you can think of is incredible. And the old joke that we have around here is, whatever your issue is, get in the chamber.
Yeah, and well, it's interesting because you know, I did a lot of research on this before I started making videos, and I tried to track down kind of the history of HBOT, and it turns out it's been around for so long, and then the level of HBOT we have now is better than what they had back then. But just something has happened, we'll call it politics for some reason. The research was never done. It worked too well, and it put like pharmaceuticals out of business, like all the other therapies that we pay surgeons for, like all this stuff that this would heal. They don't want us to know about it.
That's absolutely right.
And they don't want us to know that all you need is some more oxygen and it will fix half the problems that we have.
Yes, that's right.
And you know, and it's almost like a conspiracy now, like it's conflicting. Because
if we had this when COVID came out, it would have been a completely different universe.
Why do you say that?
Well, now we're getting all of it's 3-4 years now down the road, and we still have people that have complications due to COVID.
Long COVID.
If I post about it and I use that word, we get censored.
Exactly. So that's what I'm talking about. So there are systems in place to prevent you from seeming legitimate.
Right.
They don't want you to think that me and you are doing anything legitimate here, that this is some sort of snake oil, that it doesn't work. But if anybody does their own research on this, the uses are just, they're still not even listed. We don't even know.
Right.
We're literally, like you said, we're sticking people in there for everything now because we're discovering it quite literally helps with almost everything. I've heard of one thing someone asked, it was a respiratory condition. They asked if it helped, and it does not help with it. And I think it was like emphysema.
So emphysema, COPD, and you need to check a couple things. It's not absolutely contraindicated, but there are some relative contraindications like alveolar cysts and things like that. So we would want a hematologist or a pulmonologist to clear you for that first.
Mm-hmm.
However, in most cases, especially if it's an acute phase, it's okay and it can help.
Right,
if it's
right.
a chronic thing, that might be a little more iffy, and there might be some more considerations there. But it's not an absolute no, and in some cases, it does actually help.
And then one thing in my research, you may know about this, they say that there's certain medications you shouldn't take, and I know the list is very small, but how has that impacted your putting patients in? Have you come across any conflicts to where medication was an actual concern?
Yes, the big one is cancer. So if
Okay.
you're in the midst of a treatment protocol and you are doing chemo or you are on medications for that disease, this will synergize with them and can make them more toxic.
Okay.
And so we would like a break on either end of that treatment before you would implement this as some of the alternative.
Now, is that blanket for most all cancer patients, or is it just certain treatments?
Well, hyperbaric synergizes with almost everything, and usually in a good way. But because the point of a chemo drug is it's killing, it's a poison, it will make that poison stronger.
Right, just the same way it makes the oxygen stronger.
Exactly. And so I know cancer companies that make the medications are looking into this as maybe they can administer less of the drug to make it as effective. It's convoluted, I know, but it's crazy. So instead of using solely this as the alternative protocol, they're trying to use the technology of hyperbaric to make their drugs more effective with less drug.
Right, but it's still toxic, and you're still in. It's just that's the argument between using 1.3 versus 2.0. Like, you can still get therapy on that, just takes more of it, and the poison is still poisonous. It just takes. It'll take a little longer.
Research now is coming out, soft shell, hard shell debate. There are reasons why you might want that over this. Softer pressures are great with young kids. They're great with older adults. They're great for brain and concussion. They're great for TBI. You don't need all this for those things.
So since you bring that up, are there any conditions where 2.0 would be counterproductive or less effective? Because I've been hearing some stuff about that, and I do know. I'm wondering, I don't know if the studies are directly between 1.3 and higher, or if 1.3 was just the only available pressure that most people have, so that's where the studies come in. So if everybody has a 1.3, because that's what most people were buying before this came out, then it would make sense that the studies are based on that, because that's what we have. So do you think the studies are totally inclusive of all the information we have today?
No, I don't. And I know for a fact that there's a line in the sand. And this, like, hyperbarics has made a resurgence in the last 2-3 years. And I think before that, there was a line in the sand. The staunch hyperbaric purists were like, well, if it's not 1.4 and it's not the hard shell chamber, it's not real hyperbarics.
Right.
And that's not true.
And now they've had to admit that 1.3 is actual hyperbarics.
And a colleague of mine, Dr. Jason Saunders, just did a big piece. It's going to be a landmark study at basically proving the efficacy of 1.3 chambers. It's excellent. The research is amazing on what that can do. Can this do a few things better? Maybe. Can this be used for certain other special cases? Sure. But I think that they're both very effective tools that should be used in appropriate times.
Okay, the way I explain it to people, and see if you agree, that they can still get plenty of therapy out of a 1.3. It's more affordable. It's more portable. They can get it easier, more places to put it. The only difference is they may need 90 minutes in that, where they would only need 45 or 60 minutes in this. And we're talking about therapy pressure, not the time it takes to come up and the time it takes to come down, how long you're staying at 30 or 1.3.
If you look at the mechanisms of what's going on in terms of the hormetic response to the body, I'm a big believer in frequency over duration. So if you had to do 12 sessions, for instance, I would much rather you do them in 12 consecutive days and then stop versus once a month for the year. And that's just because the body's adaptation process is where all the magic happens.
Right, you don't get time to absorb it comes and goes so quickly, there's no effect.
So there's hours of lasting change, but that change happens at different times for different people and in different frequencies. And so I think you would make the argument, I would make the argument that an hour versus 90 minutes versus 2 hours, there really is no time that it takes to get the effect. It's much more impactful if you do consecutive, consistent little bursts of it.
Right.
And so I wouldn't even go down 45 minutes in here is equivalent to 90 minutes there. I don't think it's the same at all. It's more important that you get consistent time and that they're frequent enough so that the body can rewire itself a little bit.
Yeah, to take advantage of it. That makes sense. So, I guess that makes sense. I guess the only point I was going to try to make is that there's a measurement of oxygen in the blood. Was it ppO2 or partial percent of oxygen, that you could get to a higher ppO2 in this machine than you could get in that one.
Yes.
Not that you're not getting more oxygen in that one, but you can get to a higher level quicker in this one. So maybe you could have a quicker session in here, get your therapy, still do it every, and your proper increments or frequency is what you were saying.
Yeah.
Keep the same frequency, but you could do, and if you're on a schedule, you could get in and out quicker on this, where it might take you 90 minutes to that. You see does that make any sense?
It does. And if you're looking at, it depends on the biomarker you're trying to measure. If you're looking at telomeres, for instance, or stem cell proliferation, some of the longer term benefits of hyperbaric, could you achieve those things faster here? Perhaps. And the partial pressure of oxygen is greater because the pressure is greater.
Right.
So there's more shrinkage of the molecules of the oxygen. But the short-term benefits and the long-term benefits, I think it's important to realize the difference, and that it really does take 20, 30, 40, sometimes 50, sometimes 100 hours to get to those levels of what people want. If I'm really looking to grow new neurons and new blood vessels and new mitochondria, those are long-term benefits that are very real, but it's going to take a while. It's going to take some consistency.
Gotcha. That makes sense.
Yeah.
Well, I feel like all that has been incredible information, and I hope people watch this video and take something away from this. And then, so we're here. I'm going to call it Miami. You're in Brickell.
This is Brickell.
It's Brickell. But I consider this Miami area, basically. So here at Healthspan Recovery, they have the 2 chambers. So if you have any need for oxygen therapy, please reach out. Thank you, guys. Have a great day. I really appreciate it. Thank you, Matt.